Hello, thanks for being here. Welcome to my channel. The topic of my video today is on exam 2. This is part 2. There is a video out there on exam 2, developmental theory, health, wellness, and critical thinking. I have decided to do questions and answers to this video. So today we are on part 3 and this is your exam 2. First question, which is coming from RN NCLEX examinations. What should the charge nurses' consideration be when delegating assignments to nurses? You are a charge nurse and you'll be giving out patients' assignment to all your nurses. What should your consideration be? And the correct answer is the charge nurse should consider level of education. Maybe you have new nurses on your floors. The nurse should consider the critical thinking level of the nurse. Don't be surprised, many of you will be charge nurse within a year on the floor. You will be charge nurses because there's a lot to learn and we have to learn fast. So don't be surprised, you may have to be charged before 1 year. Okay, the next question. Are your techs allowed to ambulate patients? And the answer is yes. Techs only ambulate stable patients. Techs only ambulate stable patients. If the patient is unstable, only the registered nurse ambulates this patient. The tech can walk along with her, but the tech is not responsible to walk this patient. The tech do not ambulate unstable patients. The tech do not take care of any unstable patients. RN takes care of unstable patients. So the RN will ambulate this patient is the correct answer. With standby assistant, okay, but she is the main person responsible for an unstable patient. For Tylenol and aspirin, who gives this to the patient? And the correct answer is the registered nurse administers medications. Do not give it to your techs as if they are home. Do not give your techs Tylenol and aspirin to give to your patients. Okay, the next question. What do the nurse do in a change of shift report? The correct answer, the nurse reports actions implemented on patients during the shift. At the end of shift report, the correct answer is actions implemented are reported to the new shift coming on. That's during your change of shift report. Next question, define invasive procedures. And the correct answer, cutting, puncturing the skin by inserting instruments into the body are your invasive procedures. Next question. Your client is admitted with history of smoking. What does the nurse do? The nurse gives them smoking cessation pamphlets offered to the family also. Some patients have nicotine patches. Don't forget that. Doctors can order nicotine patches. Next question. If your patients have difficulty swallowing, what do you do? Correct answer. make the patient be NPO, nothing by mouth with difficulty swallowing. MD, the doctor will order a speech therapist will evaluate swallowing. Speech therapist evaluates swallowing. Next question. If your patient is unable to swallow a pill, what can the nurse do? The correct answer, you can notify the doctor. If it's an oral pill, notify your doctor to change the oral Tylenol, for example, to a liquid Tylenol. Some of the elderlies, they have difficulty swallowing. And if they have difficulty swallowing the liquid Tylenol, you place them on NPO, nothing by mouth. They're having difficulty swallowing. We'll get an order for a speech therapist to evaluate their swallowing. What do you know about consents, informed consents? Informed consents, the registered nurse is only a witness. The doctor or the anesthesiologist explains the procedure, benefits, risk, alternative. The RN signs as a witness. Next question. Who is an emancipated minor? Emancipated minor, to sign an informed consent, must be older than 18 years old. Emancipated minor, legally attaining age of majority. If the patient is 18 years old, less than 18 years old, less than 18 years old, the informed consent for procedures should be signed by a parent or a guardian. What does guaiac stool or occult stool mean? The doctor has ordered guaiac stool or occult stool. The correct answer, we are testing for presence of blood in stool. Maybe patient has GI bleed. We have to collect a stool specimen and send it to the lab. Next question, what do you do when your patient falls? What do you do when your patient falls? These are few answers here. When your patient falls, you will put the patient back to bed. You'll do a head-to-toe assessment. You'll call your doctor to come to the bedside to evaluate the patient. When you do a head-to-toe assessment, we are evaluating for bruises, scars, fractures, maybe sprains, whatever. But the doctor will give an order if there's any presence of abnormality for these patients, maybe to go for x-rays. We'll complete an incidence report. Very, very important. If the family is going to sue us for falls, we have to complete an incidence report. We do not mention incidence report in your nurse's notes. Just file the incidence report and place it in your file. Note the date, the time, and the doctor who came to see the patient. If there are fractures, we send the patient possible, we send them to x-ray. They hit their head, we send to CT scan. RNs, when your patient falls, RNs, when you're doing that head-to-toe assessment, immediately check your vital signs. Temperature, pulse, respiration, blood pressure, oxygen level. Falls are negligence. Falls are negligence in a court of law. How do we prevent falls? 3 side rails up with bed alarms. 4-side rails as a restraint, you get a restraint orders are not for the nurse's convenience. Restraints are when all other alternatives fail. Bed alarms fail. 3-side restraints fail. We're gonna get a restraint order that we document every 2 hours for restraint, every 2 hours, and restraint lasts every 24 hours. We get a new restraint. Okay, our next question is, patients with seizure, what do you do when your patient has a history of seizure? On admission, we always pad the side rails. Anybody who has history of seizures, on admission, we pad all 4 side rails. We put a seizure precaution sign at the door. If a patient should be admitted and during the admission, the patient experiences a seizure, what do we do? During a seizure, we move all the furniture from around the patients. This is safety. We do not want the patient head to be hitting on furniture. First, we think safety. We do not place anything in the patient's mouth. That's old-fashioned. Today, we do not place anything in the patient's mouth. First thing to know, when a patient's seizure has begun at 3:05, it ends at 3:15, look at the clock and make sure you know the time the seizure started and the time it ended. The doctor is going to ask you this information. He's going to ask quite a few questions, but the most important time, let us know what time it started, what time it ended. The next question is for Foley catheter insertion. What kind of asepsis is a Foley catheter? And the correct answer is surgical asepsis. It's a sterile procedure, sterile gloves, sterile field. Okay. Name 2 long-acting insulin, and the correct answer is Lantus and Levemir. Patients do take these home also. Next question, what is pulse pressure? The correct answer, the difference between systolic and diastolic blood pressure. Blood pressure 120/80, subtract the bottom number from the top number, 120/80. The pulse pressure is 40. How many seconds do we do our hand washing is the question, and the answer is 20 seconds. Please like, share, and subscribe. Thanks for watching. Stay tuned to part 4. Thank you. Have a good day.